Hi, my name is Tisha Saylor, and I'm the Manager of Medical Care Services for Cypress at Home. And today with me, I have Louisa Canamella.
Hello, everyone. My name is Louisa Canamella. I am the VP of Clinical Services for Cypress Living, but I am also an autonomous nurse practitioner, and I provide primary care out of our Cypress at Home Medical Care Clinic.
Thank you for being here with me today, Louisa. I thought today would be a good time to provide some education to the residents regarding their Medicare annual wellness visit.
Perfect.
I know that this spring we have a ton of residents that are due for their annual wellness visits. So we wanted to take some time today to just speak with you so that you're aware of what to expect during that visit. So to begin with the check-in process, there is certain questions that Medicare gives our practice that we are required to ask you. It goes through just a general health screening, for example. How would you describe the ease of which you can prepare your own food? A little bit about home safety as well as vision and hearing screenings. So this questionnaire is actually filled out by the resident before they actually even get into the visit with you. We encourage our residents to fill this out ahead of time. Your annual wellness visit does take a good amount of time, on average 45 minutes to an hour. So we do encourage the residents to fill this screening out on their ECW, their eClinical Work portal. The link is available, but of course, if residents do have any issues with getting onto the portal, we'll have a paper version in office for them to fill out ahead of time. In addition to the questionnaire, there's also a little depression screening that we go through. And then once the resident fills this out, I know that I then give this to you, Louisa, and you kind of take it from there. So if you just want to kind of talk through what the residents can expect as far as screenings and what the conversation looks like once they're in the room with you.
Absolutely, I am happy to do that. So I think it's important to note that from the very beginning, an annual Medicare wellness visit is very different from an urgent care visit or a chronic care visit. And it's very different from the visits that you have with your provider every 3 or 6 months. This is typically once a year. And the goal of it is to really talk through preventive care, the multiple screenings that are available to you, and whether you want to continue to do those screenings. A lot of these screenings have options to opt out after the age of 75. So I think it's important to take the time to talk to your provider about what it is that you want and don't want to do in regards to some of these screenings. Some of them can be a little minimally invasive, so it's important to note that a colon cancer screening, for example, under the age of 75, that's typically completed with a colonoscopy. That may not be something that you want to do moving forward. If it is, great. We can always facilitate that and talk through what that looks like. But if not, there may be another option, or to forego it completely. So some of the things that we talk about is colon cancer screening. We talk about breast cancer screening. The depression screening is absolutely important as well. We also take a look at your blood pressure and see how that's doing in addition. One of the other things that we talk through is any alcohol intake. And probably one of the most important things that we touch on is advanced directives. That's something that a lot of people have questions about. We talk a lot about what advanced directives are, including POA, living will, healthcare surrogate, who is designated for you. And it's important that we have that information as well. But we also talk about, a do not resuscitate and what that looks like in the state of Florida, what the requirement is. And you might not always know right away, and that's why it's important to ask questions. What does this look like for me at this age? What does CPR look like? A lot of people don't really know what that looks like as well. So this is a great opportunity to have those conversations. There's a lot of education that goes and a lot of discussion that is had during these visits. And this is just the time to ask all the questions that you have. As Tisha mentioned, this can be a prolonged visit. This is not typically just an in and out visit. It's once a year, and because it's once a year, it needs to be thorough. So there's a lot of discussion that happens. I think it's important to note as well, just because when you're in the clinic, sometimes things pop up, right? Something's been bothering you for the last few weeks, or you want to talk about something different. Usually we can always facilitate that. But we are required to just let you know that because it's not part of the actual annual wellness, we can still talk through that and we can still treat you for anything that's going on, but it will require us to do just a separate code that gets charged to Medicare as well. So it's just important to be forthcoming about that. We do have a packet that's available. It's in ECW already. If you want to take a look at what's included in an annual wellness, it provides great education on diet, exercise recommendations, a lot of the things that really just keep you healthy. And it's important to make sure that you have that information to look at. We do have it on paper in the clinic as well, and we can always facilitate a paper copy. But if you have ECW, where would this be located, Tisha, in ECW?
So in ECW, there is a tab that's called Patient Basket.
Okay.
And then it's a packet, it's 50 pages of education for the residents. But like you said, we do have printable copies in the clinic. And then, so just to clarify, Louisa, really the annual is the time to really put your care plan together for the year.
Absolutely.
It's not so much to talk about your chronic care conditions or anything that is going on. I know we do review lab results sometimes, depending, what is going on with that patient. But again, that's not a part of an annual. Your annual is really to go through the different screenings and to really come up with that care plan that the resident wants for the rest of the year.
Absolutely. If it's something minor, one thing, we can try and add it on. If we're looking at 2 or 3 things that you want to talk about, most likely we'll ask you to just schedule another visit and we can facilitate a visit for that specifically within that week for sure. We're very flexible with that. So.
And I know, Louisa, you did say that typically this does happen one time a year. So Medicare, they do only pay for an annual wellness visit one time a year.
Yep.
They're very particular in the sense that it cannot be one day sooner than the day before.
Yep.
So sometimes you'll see that we are having to reschedule your annual based on when you last had it.
Correct.
Like I said at the beginning, there are a ton of residents that are due for their annuals come this spring. So if you are not sure if you're scheduled or you want to get scheduled, just stop into the clinic and we can definitely help you with that. And then I also wanted to take a minute to just introduce to you the Medical Minute. The Medical Minute is going to be going out next month in February, and this is something that you can expect quarterly from our team.
We plan on focusing on a different topic every quarter. I'm excited about this because both Dr. Lou, who's our medical director, and myself, we enjoy education. I think education is power. And if you have, the education on how to keep yourself well, that's the very first step that we should all take. So we look forward to providing different information. And, if you have any questions about anything you happen to read on the Medical Minute, we're more than happy to answer that. It looks like the first Medical Minute will be on the annual wellness, which matches what we're doing today. And it sounds like we also have a health fair coming up soon, right?
We do, yes. So next month, February 19th, is our Health and Wellness Fair. Our team will be there, so we hope to see you there as well. Well, thank you so much, Louisa, for taking the time today. We look forward to seeing our residents in the clinic.